It's a pleasure to see you, and I'm grateful you are joining us for a Friday webinar. It's going to be the final webinar of our ISCA HEPA webinar series, and I'm happy to welcome you. I'm Carole Ponchon. I'm the e-learning coordinator for ISCA, the International Sport and Culture Association. And today, I have the pleasure to welcome you and host you for a quick webinar that will discuss HEPA, Health Enhancing Physical Activity, and NCDs, non-communicable disease. Before we get into the core of this topic, just a few basic housekeeping rules. Everyone probably knows about it, but better to make sure that it's okay for everyone. So we will be using the chat option from Zoom, so feel free to include your name and the name of your organization so that we know who you are. Please mute yourself when you are not speaking. And actually, I think I'm hearing someone with open mic. I'm not sure, but I can hear some background noise. So that's a good timing to remind ourselves to mute it. Why we're asking it, it's not that we don't want you to speak. Actually, we will invite you to open your mic at some points. But the webinar is recording. You have been probably reading this message when we join. And we are recording it to make sure that many people can see it afterwards. And we also include it into some e-learning course. So that's the reason why we're asking you to mute yourself. It's nicer to see your face. So if you have a stable internet connection, please put your camera on. It just feels nicer. And as mentioned, please feel free to use the chat box to ask any question or share comments. One of my colleagues, Manal, is going through the chat. We'll help monitor it, and we will make sure to come back to this question or comment you may have. That's it from me now in terms of basic housekeeping. So let's go to the core content. Today we will discuss how we can muscle up our game and help tackle the #1 epidemic in the world. This is actually written second. It was planned to be second of our third webinars, but it's the final one. And the reason for us to build this, for ISCA to offer it to you with the experts that we'll be inviting, is to help you deliver health-enhancing physical activity for all, and in particular with a view to tackle non-communicable disease. I will not be the one speaking the most today, and I'm grateful about it, also because we will learn a lot. So I'm welcoming virtually to the stage 3 of our speakers today. The webinar will be developed and split it into 3 parts. The first part will be a keynote presentation by Andrea Backović Juričan, based in Slovenia. She's an ISCA HEPA expert group member. And then after this warm-up, we will fly back to Germany and hear a presentation from the Pluspunkt Gesundheit practice by Pia Pauly and Heidrun Krämer. So I've already been speaking too much. I will now give the floor to Andrea, and welcome, Andrea. Let me once again thank you on behalf of the whole ISCA team who is here for your time and for sharing your presentation and expertise.
Thank you very much, Carole. So as Carole said, my name is Andrea Backović Juričan. That's how it's pronounced. I'm really pleased that I was invited to speak as an expert on NCDs today at this ISCA course. My field of work as a national health promotion at the National Institute of Public Health in Slovenia is mostly related to public health policy development, implementation, evaluation, also NCDs research, physical activity promotion, and development and implementation, different kinds of interventions of NCDs prevention and physical activity promotion, especially when it comes to the health sector. We also collaborate with different NGOs, mostly sports organizations, especially when it comes to physical activity promotion. But now in the next 10 minutes, I'm going to speak to you about NCDs in general. So can you see my PowerPoint?
Yes, we can, Andrea.
Yes. So how to muscle up the game and help tackling the #1 epidemic in the world, which we already know that these are NCDs, non-communicable diseases. But on the other hand, how can we do it? Because most of us are also experts in promoting physical activity, conducting different kinds of intervention in relation to health enhancing physical activity and so on. So let us see. I'm trying to move my slide. Yeah. Let us see why makes NCDs the #1 global epidemic. First of all, they are #1 cause of death in the whole world, so globally. Currently, NCDs kill 41 million people each year, so it's accountable for approximately 71% of all deaths globally. We also call NCDs chronic diseases of modern age or modern time because they are related mostly to the way of how we live, so to our lifestyle. If it's unhealthy, then we have much more chance of getting any major group or even different groups of non-communicable diseases. More than 15 million people, especially between ages of 30 and 69, die from NCDs also each year. When we look at the European region or WHO, there was a report recently published on NCDs, and they say that NCDs cause around 90% of death in the European region alone, WHO European region, and they are also responsible for 84% of years living with disability. So these numbers are pretty huge. We all know that also all major groups of NCDs are on the rise, but what groups are accountable to or related to NCDs? First of all, there is a group of cardiovascular diseases. Then there is a type 2 diabetes. Many types of cancers as well, like colon cancer or breast cancer. We also know that many mental health problems and diseases are also in that group of NCDs. For example, anxiety and depression, then different kinds of chronic respiratory diseases, and also musculoskeletal diseases or disorders that are still in many developed countries #1 reason for being absent from work. And nevertheless, we have also overweight and obesity on a rise as well. So these groups, major groups of NCDs, actually represents the majority of disease burden. 2/3 of adults and 1 in every 3 children in the WHO European region alone are living, for example, with either overweight or obesity. And during the COVID-19 pandemic, this situation got even worsened. So the situation deteriorated, especially among younger generations. So that's something that we have to have in mind. And different countries and also WHO prepared a lot of strategies how to tackle that particular problem as well. Let's see how we look at the correlation between NCDs and physical activity or inactivity. So we already know, because it's proven by different scientific researches, that NCDs are related to the spike in physical inactivity, for example, also unhealthy food intake, different kinds of mental distress, alcohol and tobacco abuse, and nevertheless a poor quality of life in general. And mostly people who are vulnerable or vulnerable groups of people are even more likely to get involved or with NCDs or are related to these different kinds of risk factors. So in the future, the prognosis of vulnerable groups is not really good, because they have much better chance of getting any of these NCDs diseases in general. They are linked by common behavioral and also biological risk factors, underlying especially socioeconomics and demographics determinants of health, and also opportunities for intervention. So what kind of opportunities of interventions do we have besides, for example, increase of physical activity, or even better, health-enhancing physical activity? So we should work in preventing or tackling NCDs, mostly to support people, for example, to quit smoking, to reduce or stop using alcohol, ensure healthy eating, and as I said, increase physical activity of the populations and especially vulnerable groups. A total of 87% of NCDs deaths in the WHO European region were actually caused by major behavioral and biological risk factors, which can be preventable. So let's have in mind that all of these diseases that I'm talking about can be preventable, and the best way to prevent them is to live healthy and also be more physically active, of course. For example, physical inactivity is one of the most important risk factors for getting any NCD. And there is a strong evidence for comprehensive health effects of regular physical activity across the lifespan. I would like to draw an attention to the new WHO European region publication that you can see here on my slide from the BRIEF project, which is actually the integrated brief interventions for the non-communicable diseases risk factors in primary health care. And it represents a manual for health workers, but not just for the health workers, also can be a manual for different NGOs as well. So if we have, for example, 1 minute or 5 minutes to spare, or 10 minutes, or even more than 10 minutes, what kind of advice in healthy living can we give to our clients or our patients? So I would like to encourage you to download that publication, because you can find a lot of very useful advices, not just on physical activity, but also healthy eating, reducing smoking, alcohol abuse, and so on. When we recommend to our clients and our patients how much physical activity should they be engaged in, I would also like to recommend that you refer to the WHO guidelines on physical activity and sedentary behavior. But please do not forget also give them an advice on sleep, because we should have in mind that everybody has 24 hours in our everyday schedule. So sleep does matters also when it comes to NCDs prevention. And because WHO guidelines doesn't include at this point also sleep recommendation, you should look for the recommendations on sleep that maybe the International Sleep Association gave them. For example, for the adult population, is very well known that 7 hours plus sleep during the night is the best way to stay healthy in the long run. So we should assure to our clients and our patients that they sleep, if they are adults, at least 7 hours with no interruptions, and go into the deep sleep. Okay, unfortunately, NCDs represent also a huge economic burden, but not just NCDs, also physical inactivity. So they generate enormous cost. For example, cardiovascular diseases alone are estimated to cost EU economy 210 billion euros per year. Then again, physical inactivity imposes economic cost of a little bit more than 80 billion euros per year to the EU alone. And it's also estimated that by 2030, these annual costs will arise to 121 billion euros. We also have an assessment made by WHO, and this publication, Global Status Report on Physical Activity, was published in last year. And in this publication, you can find an information that globally physical inactivity cost health systems alone 27 billion American US dollars per year. And also they counted how it's going to be by 2030. So these costs will probably rise to 30 billion US dollars per year. So these we are talking about a lot of money that can be spent much more useful if people would be physically active and stay healthy and live healthy. So what are the challenges, challenging indicators and recommended approaches in the relations of preventing NCDs and being more physically active? First of all, that's why I emphasize that in the beginning that I am also dealing with public health policy. First of all, each country should make healthy public policy or different kind of healthy public policies. So our politicians, including us as an expert or practitioners in the field, should make bold political choices together for health. I would like to draw attention to a special document which is related to health promotion, and it was released at the 8th Global Health Promotion Conference in Shanghai in 2016. And this document is called Shanghai Declaration, if anybody heard about it. And in this declaration, the experts actually are telling us that promoting health and also health enhancing physical activity is basically it means that we are promoting sustainable development. But how should we do that? How should we do that? We have 3 pillars of health promotion that can build sustainable development, so we can reach 17 sustainable development goals by 2030. And these 3 pillars of health promotions are good governance, healthy cities, and health and also physical literacy. But all of this needs and requires a cross-sectoral and also interdisciplinary approach, including networking. Otherwise, it cannot work. So what particular approach should I recommend to you practitioners in the practice and also maybe the experts? One of the very, very effective public health approaches is called community approach to health. So I would recommend this one. But why? Because it connects the community on a local level. There actually health is created because people are living on a local level and going to school and to work, and they socialize on the local level, not on the national level. So community approach to health. And the consequence of community approach to health, it's not just that it connects community, but also it enables community development as well. So initiators and carriers of that community approach to health can be various actors in the local community, not just health institutions, but also, for example, health insurance companies, municipal administrations, so mayors, schools, work organization, civil society, different kinds of NGOs and association, and also, of course, sports clubs. To conclude my presentation, I would like to give you 2 key messages. The first one is that NCDs prevention should be implemented by overall health and also HEPA and sports promotion. And the second one is creating happy-friendly quality seal health sports programs and clubs that you will hear from my German colleagues after my presentation. How is it done in their country? And or integrated chronic disease prevention programs that maybe government is implementing on the national level, using multiple partnership can tackle #1 epidemic in the world, which are NCDs. Maybe I would like to invite you to look at the Slovenian program, which is called Together for Health, on this particular link, so you can learn how Slovenia was successful in the last 20 years with this program, and what are we doing to reduce chronic diseases among our Slovenian adults, because this is the program that is actually named by the WHO alone as a best practice program when it comes to the integrated chronic disease prevention programs. Thank you very much for your attention, and I'm of course available for any kind of questions afterwards. Thank you.
Thanks a lot, Andrea. There's a lot of information to digest for sure, and a lot of things to come up for sure. And maybe something I didn't mention to all participants so far is we will make sure that you receive a summary of what has been said, but also the presentation slides. So you don't have to take too much notes at this stage, and you can be sure that we will share it with you. And Andrea, you also make a very nice pass, let's say so, to our upcoming expert good practice presenters. And actually, Pia and Heidrun, I'm very honored to have you on board and to welcome you officially to the webinar. And I know a bit about Pluspunkt Gesundheit initiative, but I'm really looking forward to hear more. And maybe Pia, I can ping you and ask you if you could maybe start by bringing us all to where this initiative started. What is HEPA in the German context and in your context in DTB, the German Gymnastics Association Federation? What were the challenges that you were facing, or maybe it was for your members? So please tell us a bit the story and the context there.
Thank you, Carole. First, for the invitation and for the opportunity to talk about our action, Pluspunkt, and our fight against physical inactivity. And thanks to Andrea for the key data and for the key data to the #1 global epidemic and the challenges and the recommendations. I think we had to deal with some of them, or with the problems. And so, yeah, we will refer to your speech later. I will share at first my my screen. So you see my screen. Yes. I would like to give you a short helicopter view to the politics of the DTB with our aims and methods. First of all, our country federations and our clubs are in our main focus. This is why we as national organization, we are only as strong as our subdivisions. And so it's very important for us to support our clubs, to work together with them, to exchange experiences, to provide knowledge and education and tools so that our clubs can develop a modern, attractive, and qualified range of offers. This is very important for us. And this is it's the first aim we have. And this is our task. also important for us is to be a strong, influential organization. We need public perception, we need networking, we need lobbying, and for us and our clubs to represent our interest, to be heard in the public and in the government. And based on these aims, we observe social developments like inactivity, like climate changing, multicultural society, the aging society, sustainability, and all these developments in the society affect our work and affect the work of our clubs. And so we take them up, these developments, prove them, draw our conclusions for the further strategic orientation, define and decide it as a focus topic, and develop concepts and measures and activities. The next one. Yeah, now. So the number one epidemic, growing inactivity of the population, and associated consequences and risk are immense. Andrea talked about it, very impressive. And so the DTB felt and feel a responsibility to do something against it. Who else can get people excited about physical activity and physical exercise than the Sports for All organizations? And because we are the experts, we feel as experts in this field for physical exercise. And so we know we and our clubs are able to make a contribution to the society. But we have to support our clubs so that they have they can be active. So you can read our objectives. We wanted to activate people. This is one point. But the more important point for us is also not only to activate them. We want to bind them to the club, to be a member, because only then the action is sustainable. We all know if the people are binded to a group and do something together, it helps to change their behavior. And so it's very important for us that they get a member, that they come to our club. And very important also is the decision of the board or the General Assembly to this field, because you can get resources to do something, and the whole organization stands up for the topic. And this is very important for us if we work on this topic. So, and at first we had to raise the awareness. We wanted to raise the awareness of the issue inactivity to the clubs and to show them the opportunities for the club development. And we want to support the clubs and enable them to make offers for inactive people. So in this field, at first we developed and implemented the Action Pluspunkt, our seal of quality. No, at first it was not a seal of quality. At first it was a marketing tool. We implemented a marketing tool to raise awareness in the population so that they know, okay, this is an offer with quality. This was the first point. And then this was the first point. And then we saw, okay, this is not enough. During the implementation, we noticed this is not enough. We needed help. And I will come back later in my second part to this point. We noticed we needed knowledge to reach inactive people on one hand and to help people to change their sedentary behavior. And so we built a network with sports scientists and public health scientists. and we see that we needed the acceptance of the healthcare system, and because we wanted to cooperate with them. So this was the first point. And in our start 20 years ago, in this time, we also thought about how to activate them in special offers, in low threshold offers, how to reach them. We don't thought about the infrastructure of the communities, of the cities, to make the daily life more active. We started at first with activating them with low threshold offers, because this is what we can. And in the last 20 years, then we had a shift, so that we saw, okay, we need both. We need special offers for the people, but we have also to talk with the cities, with the communities, to activate people in their daily life. And this concerns infrastructures, parks, and so on. But we started with the point to activate people, to attract them, to motivate them, and try to bind them to this activity. Yeah.
Thanks a lot, Pia. You brought us 20 years back ago, and you're celebrating, we can see in your logo, that DTB is also much older than 20 years ago. But thanks a lot for painting this background and the origin story of DTB relationship to HEPA approach towards NCDs. That I think it's a humbling presentation for all of us and from you, and thanks a lot for sharing this. And actually, because you made a great teaser for the Pluspunkt Gesundheit and this zeal of quality, well, if we would be in a normal room, I would turn my head to Heidrun, but I'm still watching from my camera. So maybe, Heidrun, I can pass you the ball, and I would love to hear from you what is actually the Pluspunkt Gesundheit? What are their key points? Who is working on this initiative and how it looks like? Would you mind taking us there and build on our knowledge, but also capacity on it?
Sure, thank you so much. I will also share my screen.
We can see it.
Okay, perfect. So thank you, Pia, and thank you, Carole, thank you, Pia, for introducing the goals of the DTB. I am looking forward to sharing our function in the area of health sports. With the Pluspunkt Gesundheit, the DTB developed a seal of quality to award health sports programs. The Pluspunkt Gesundheit stands for well-educated trainers, small groups, and regular training. For the DTB, the Pluspunkt Gesundheit is an option to stay in contact with its club through targeted subjects. We can bundle different health sports-based topics like continuing education, newsletters, or events under the umbrella of Pluspunkt Gesundheit. In coordinating with sponsors or partners, we can highlight the benefits of certified sports in clubs. The DTB started to develop standardized programs according to the guidelines of sports sciences. By standardizing them, we can improve the quality of the club's health sports and include the official requirements of the health system, such as the proof of effectiveness. All standardized programs are evaluated by experts from different universities. And here are the goals of the health exercise programs. The participants. Our goal is that our participants will adapt a healthy and active lifestyle by altering their personal behavior which in turn will reduce the chances of developing NCDs. To achieve this, the programs consist of increased exercise for endurance, strength, coordination, flexibility, and relaxation. And with the use, for example, of motivational techniques or knowledge, an increase in member participation will occur, regardless of everyday life distractions like bad weather or long work hours. With having, for example, a fully qualified staff of trainers, networking with physicians or local authority districts, the setting creates a sense of belonging to the club and can also support the regular attendance of the participants. For example, working with local authority districts can potentially improve sponsorship possibilities. And here you see the structure of the standardized programs. Program starts with an opening sequence. The trainer welcomes the participants and asks how they are doing. Then they go over to the previous lesson and discuss their homework. And lastly, have the trainer describe their next lesson. The upbeat warm-up sequence focuses on the whole body by using music, games, or exercising with a partner. This sequence is also a mental arriving in the lesson, and by using music, games, or exercising with a partner, the mood can be improved. The sequences 3, 4, and 5 are focused on increasing the fitness. After the relaxation sequence, the final activating sequence eases you back into your normal daily activities by using, for example, short mobilizations. The group has a short review of the lesson, and the trainer provides an overview of the next lesson. Before dismissing the group, the trainer will ask to reflect on how they now feel compared to at the beginning of the lesson. Asking these types of questions can make people realize the benefits of activity in order to feel better. Every sequence can combine with theoretical input. For example, the trainer explains why the lack of movement is a problem. Therefore, the participants must figure out a way to change their daily life. Perhaps they can do it as a partner work while they are walking in the gym. And for homework, they could log or track their activities. For the club, the Pluspunkt Gesundheit is a possibility to present their skilled trainers and their high-quality programs. They can cooperate with the health insurances, and lastly, they can draw the attention to their programs. And here you see the Pluspunkt Gesundheit in the clubs. These 3 books are an expert from our standardized health exercise programs. Here is the Pluspunkt Gesundheit logo. It's the gray one. Integrated in a sports club's program schedule. It's Monday, Tuesday, Wednesday. Here you see on the left-hand side a program advertisement for a back workout where the logo is placed at the top. Here, see it. And in the middle, there's an invitation for a day of health. On this day, the sports club provides its members and interested people information about exercise and nutrition. Here you see a certificate presentation shown here online because of COVID-19. So thank you for your attention, and now I give back to Carole.
Thanks a lot, Heidrun. And well, I have plenty of questions. I'm pretty sure the participant as well, but maybe one of them, before we move to the tips and tricks and things like this, Heidrun, would you mind just briefly telling us a bit more how DTB is training the trainer in the clubs? Unless I'm wrong, that's also one of the added value of the Pluspunkt Gesundheit, like clubs are getting this zeal of quality. But I'm really curious to hear a bit about this training process, or maybe it can be you and Pia answering, but I'm pretty sure we can learn a lot from you two in terms of how this training was created and how it has made an impact. I know it's somehow a kind of slide. It's sliding into the next part anyway. So, but I would be curious to hear just a bit more about Pluspunkt. I'm sure you have so many things to say, and you were stressed by the time. So I would like to give you the opportunity to say a bit more.
Okay, thank you. Yeah, first of all, the trainers, they have to do a license, and I think the license is about 100 hours. I think takes 100 hours. And on top, they have to do a special further education for these standardized programs. So they get a deeper impact of all these facts, like to support or to increase the resources, like the physical resources or the psychological resources.
Thanks a lot. I think it just brings into perspective the whole journey you have been coming from back 20 years ago, where there was this shift and this realization of, okay, we need to do a bit more. And now there is this training of more than 100 hours and some cherry on the cake. So I just felt like it was important to pinpoint it, and maybe there will be more questions afterwards by the room. Thanks a lot, Heidrun, for this. And Pia, I know you have prepared some very inspiring presentation about the tips and tricks and the lesson learned, because, well, from this 20 years journey, I'm sure there has been probably some pitfalls, some learnings, etc. And you're so willing to share it with the participants. That's a privilege for us. So if you can just, tell us maybe a bit more about the impact it had on your federation as DTB, but also what we could mention, the do's and don'ts, if you so wish. The floor is yours.
I will do my best. It's always very difficult to describe a system in a country, because our system is, I think, or each healthcare system and each politics is different in each country. And so our Pluspunkt concept is also based of a law in Germany, because our insurance companies, they have the law to be very active in the field of prevention. And so they have money, and they have to spend money in this prevention. And all the Pluspunkt offers, all the clubs who offer such a standardized program, they made the advertising. The people come and say, okay, I will join the offer. Then they do this over 3 months. And after the 3 months, they get a certificate. And with this certificate, they go to the insurance company, and the insurance company pay them the money, the fee they paid for the course to 80% back. But this is only in Germany. And this is very good, because inactive people, they normally at first want to try. They don't want to bind directly to a club or to an offer. They want to try, and so they have the opportunity to try such a program, a health program, over 3 months. And if the trainer do his job with the improve of the social, psychological resources, then the people say, okay, I feel it's good for me. And they have a binding to the group and to the club. And then many often there will be a member. This is the idea to have a 3 months course. They get the money back. They have to pay something, but they get it back from the insurance company. And if they are, and after the 3 months, they have to decide: are they did they want to be active in the club or not? And many people say, okay, we will be active. I feel it's good. So the impact of our initiative, I go to the presentation, is this that the Pluspunkt has evolved from a marketing tool, because at first it was only a marketing tool, because in this time we had no law in Deutschland for prevention. And so, and there were many other, or some other competitors on the market. And normally we had commercial competitors, and all these want to buy courses and to buy physical activity. And so we said, okay, we need a marketing tool, and we need quality, so that our clubs can do the public relation. And after 20 years, everybody in the DTB and the clubs and in the regions know the Pluspunkt. It's a well-known trademark at the moment. For us, it was very important, the impact at a political level and lobbying. Today we have to say, yeah, we feel we are accepted, and we are known for our efforts to promote physical exercise and health. And this is very important for us as organization. We see this, we were asked to take over the national coordination of the European Week of Sports. We planned and organized the President conference in 2020. And we were asked in the last 5 years more and more to implement projects to promote physical activity and receive the funding. And such projects are, for example, active and fit living in the community for elderly people. This is financed by the healthcare system. They finance, the project runs over 7 years, and the aim is to activate elderly people to improve their physical activity, and on the one hand, and on the other hand, to have a look to the environment, and not the environment, to the infrastructure of the cities, to make the physical activity in the daily life more safe and invited. Another one is our project Fitness Locations, with fitness hotspots and parks and fitness trails. We get the funding from a health insurance company for 9 years. And so it's very, we can we have contributions in the cities to improve the infrastructure so that people can be active. And the last year we got a funding for physical activity and exercise against cancer, with the same with the aim to raise awareness that physical activity can minimize the risk to get cancer. And all these things are the result of our, that we are active in this field. And you can see facts and figures. We have not so much we have figures over the last 20 years, but we put now only 2 figures over the last 5 years. In the last 5 years, we certificated over 10,000 Pluspunkt offers. And you have to know these Pluspunkt offers are valid for 3 years. And these Pluspunkt offers are over 3 months. And the club can repeat them. They can do Pluspunkt offers a year or 3 if you want. And in each Pluspunkt offers, you have the maximum amount of 15 people. It's a small group so that the trainer can also have a good, can betreuen. Oh, I don't know. Okay. And we have certified in a special further education, at first in the field of prevention, and then for the health programs. They get a special introduction how to use the health programs. What I have to do to improve the social, to help the people to change their behavior. This is very important, and this is not so easy. So I will come to the next. You ask for pitfalls or something like this, and yeah, we also had some, and I come back on this point to Andrea. Her recommendation is to cooperate, to establish a cross-sectoral cooperation also on the local level. And at first, when we developed our marketing or our seal of quality, we thought we have a marketing tool, Pluspunkt, and then all the inactive people will come. If we make an advertisement, they will come to us. But our experience were that the inactive club members used the offers. This was okay because they were club members and inactive. This is okay. But we had many active members in these offers because they were curious. They want to change what they are doing. They want to see what is this offer, what is special in this offer. And so this was not the idea. We don't want the active people in these programs are for beginners, for newcomers, and not for active people. So, and we had to realize that we hardly reach really inactive people. And we have to change this then. And so we recommended the clubs to find partners on the local level who are persons of trust and close to the target group. Because they can recommend the Pluspunkt offers and motivate people to try out. And the personal speech is very crucial in this field. And we recommended the clubs that they have to go to the places where the target group live. So the networking was very very important, so that on the local cooperation consists of health insurance companies, social services, charities, sometimes also the church, workplaces, and quarter management. This is very, very important. And in this field, we had to learn, and our clubs had to learn a lot. And so networking and cooperation are our most important success factors on all levels, on the nationwide, also local. And nationwide, it was also for us a learning. We worked with the sports science and public health science because they had lots of knowledge for us. It was very great. At first, we don't want to work with our German Olympic Sport Confederation. We want to do it alone. We want to do it alone. We developed and implemented the concept. But to represent our interest to the ministry or to the health system, this was very hard alone. And so we cooperate with our German Olympic Sports Confederation because he is the main contact for all ministries, because he represents all sport organizations and more than 27 million memberships. And so we had to notice, okay, we are powerful, more powerful together. Yeah, and our advice for a good network and cooperation, it's very important that all partners have the similar objectives. We need the same. Yeah, we need to reach the same goal. The goal must be clear, so that there is a win-to-win situation for every partner. And it was very helpful when if the competences of the partners complement each other, because we have our competences. And the social service had other competences, charities had other competences, and so this is very good. And the first part, a network. A network has to be maintained, has to grow, and this needs time. And this is a very important issue, that you need time for all of this, to develop, to bring it in the field, to convince the people. And it's not done in 5 years. You must be aware that this is a topic, 10, 20, 30 years. And at the moment, we say we never finish with this. It's a topic you never finish. The Pluspunkt management at the moment is business as usual. We do this. It's a normal part of our organization. We develop each year a new health program, so that the programs are attractive for new people. And at the moment we feel we need, perhaps we need a new step. We have to go further on. We have this possibility with the projects, with the other projects we got. But we think about the workplace health promotion, because we think this is a very, it's a field, it's not easy, it's a difficult field, but it's a very important field, because there are the people, there are active people, but also there are inactive people. And our companies in Germany, they have also the task to take care of the health. And so we want to go in this field and have in this field, we want to work in this field, but we need also at the moment experience how to do this, how it works, and so this is the point for us at the moment, to see what are the rules, what are the rules and what we can do and which concept we can build up. Okay.
Thanks a lot, Pia. I know you mentioned you need time for this kind of experience, so that's why I provided a bit more. But it's also very inspiring, and there's many things to discuss and etc. So I just want to say thank you to you, Pia and Heidrun, for this insightful presentation. And actually, instead of reacting, I will just pass the ball to Andrea, because I'm sure with your expert OKAs, you may have some reaction to what we have just heard in the last 40 minutes. But I will also challenge you with time so that we can also get the participants to ask their own questions. So basically, Andrea, I'm curious to hear from you if from the Pluspunkt Gesundheit presentation that we have just heard, if there is anything that is surprising to you or one point that you think really need to be highlighted and pinpointed for all of us who are here sitting and wanting to learn.
Yes, maybe I should just, well, thank you very much, Pia and Heidrun, for your presentation. It's very impressive what you managed to build from a simple marketing tool, to the SIL, and to actually, promote it national-wide. Mm. And you've been asked to this year to, as I understand, to host or to coordinate the European Week of Sports. Is this the first time, or you done it before?
No, we did it since 2016.
Oh, okay.
The first time it was our umbrella organization, the DOSB, but then they noticed they cannot reach clubs and they cannot reach people, and so they asked us to do this, and the Ministry of Sport also. Yeah.
Are you going to reach health institutions for this year's European Week of Sports? Because in Slovenia, from the beginning, we are working together, sports and health organization, the whole week of sports.
Mm-hmm. Oh,
so
okay.
This is something that, I would like to invite you to, because it is feasible. It is feasible, working hand in hand. Yeah. Mm-hmm. Okay, this is something that I wanted to comment. Then another thing, when it comes to the health systems, we have actually 4 basic health systems across different countries. And for example, Germany and Slovenia both have the same Bismarck health system. But within that system, we function or are financed pretty much very differently, because there is a cultural and political differences and so on. But basically, we have the same system. It's Bismarck's. And then we have also beverage health system. For example, United States has a marketing system, which is very much business orientated. Then the former countries of Soviet Union and Yugoslavia and Cuba also had the system that is called Semashko system, and only Cuba has it at this point. None other country have it. So these are the 4 main systems. But although some countries have the same basic system, it doesn't really mean that they work. Their health system works the same among the countries, because these systems can be divided, as I said, to the different political situation, to the different, I mean, historic situations, and so on. So, for example, in Slovenia, you mentioned the behavior changes approaches, right? In Slovenia, usually our sports clubs are not dealing with, or sports organization with behavioral change so much. But this is something that community health centers are dealing with. So, for example, Together for Health program in Slovenia, all community health centers and health promotion and health education centers are dealing with the behavior change, especially of adult populations. And when we manage to change the behavior of the person, for example, to eat more healthy or to be more physical activity, then after a couple of months, we send those clients and those patients to the sports clubs so they can train more. And this behavioral change workshops and individual approaches are fully paid by our national health insurance company. But from the national health insurance company, our NGOs and also sports organizations are not getting any money. And it's a different situation when it comes to Germany, because you are getting paid for your job from your insurance companies. Yes. So why am I saying that? That you are coming from different countries. Our participants are coming from different countries. So first you have to investigate what kind of health system do you have and who is paying for what. And if you have a chance to get any funds from the health insurance company, great. But if you don't, the health insurance company are not the only insurance company out there. So maybe find your sources somewhere else. But every single country is a different country. And please, guys, make connections with health professionals in your country, because this is something that will make you worldwide, while in the long run, we are actually dealing with people who are ill. And when you are ill, you are most motivated to change your behavior. So we can send you a motivated people to deal with in your clubs. So that's why I would like to invite you to make friends with health professionals across your country. Okay?
Thanks, Pia. That was thanks, Pia, Heidrun, and Andrea. And Andrea, that was a clear and important call to action about the partnership and the networking and etc. I just want to take the time to really acknowledge the sharing and the knowledge that you have just shared with all of us. And as we are moving to the next and final leg of this webinar, where everyone is invited to pour question and make sure that we can make the most of the time that we have together, I just really wanted to thank you for your time and your energy and your great advice. And I will also have a look at my colleague Manal. She was going through the chat. And have you seen already? I've seen that there has been some question already answered by Heidrun as well. But if you have seen any special comments or questions that you feel should be raised now, Manal, please feel free to voice them. And I'm also inviting everyone who would like to ask a question to Pia, Andrea, or Heidrun, or maybe simply react, to open their mic after Manal will have shared the chat feedback.
Yeah, sure. So we have, as you mentioned, already some questions asked by Michael that were already answered by Heidrun, but he asked actually the last question wasn't answered yet, which is, are individuals being referred to the Pluspunkt program by their medical doctors?
Yes, there are some recommendation from doctors, but the point is that it's the problem from our system. The medicine people who are working in medicine area, they are not paid for recommendation. They are paid. They get the money for the work for the if they do some reception, or if they but they're not paid for the recommendation, please go to the sports club and do some active stuff, or yeah.
Yeah, this is a big problem for us, and it's great if in Spain this is working together with our DOSB. We worked on this to have a receipt for physical exercise, the doctors, they get these receipts with the recommendation if there are if they see sedentary people, and to recommend them, to write the receipt, to recommend them what they are doing, to recommend them to such a Pluspunkt or Sport for Gesundheit offer. But yeah, it's not easy, because our doctors are very concentrate of their normal work. They concentrate on the research, on the physicals, on receipts, but not to say it would be good to be more active. So at the moment, or after the pandemic, now there is a big movement in this to change the mind of the doctors, so that they say, okay, before I receive pills or something like this, sport and physical activity is the best multi-pill for all people. But we have to, we have to have a change of the mindset of the doctors in our system.
Yeah, and
can I add to that thinking? This is another thing that we should have in mind, that also within our health system, we use different modules to promote health or to promote exercise. For example, we've been talking now about exercise on prescription module, which comes from Sweden. And guys, I don't know if you know, but the next conference of the European physical activity on prescription is going to be on Valentine's Day, on 14th of on 14th of February. So Carole and Sashka, after this conference, I will send you the program, so you can send it to the participants, and maybe they can attend as well. Another thing, for example, in Sweden, this works very well, and in many other countries as well. But unfortunately, it can never work in all of the countries. For example, in Slovenia, we've been trying to work, but the thing is that our, for example, general practitioners are not experts and are not going to be experts in physical activity prescription or exercise prescription, never. So we came up with another module. Our medical doctors are usually just giving preventative checkups, and also our nurses working for the general practitioners under the Together for Health program. And then after the preventative checkups, those people who are motivated enough to change their behavior are sent to the health promotion and health education centers, when interdisciplinary team of people, of experts, are working, trying to change their behavior on individually or in workshops, so group work. And this team consists of nurse, psychologist, physiotherapist, dietitian, and kinesiologist. So 5 different experts are dealing, instead of doctor, with the behavior change of particular person, because only biosocial model of behavior is really effective one, not really biomedical module anymore, and we all know it according to the evidence-based, where the doctor is, you know, on a higher level than other professionalists. So you should also see if the exercise on prescription given by medical doctors would work in your country or not. If not, then there are also other modules to deal with. But I would really welcome you. Oh, you already give the. Thank you very much.
Yeah, Laura has been
Valentine's Day. Okay, okay. So you have a link to that conference on Valentine's Day, exercise on prescription already. Thank you very much, Laura Maria. Yeah.
Carole, can I add some point?
Yeah, please. But let's try to be super mindful of time, because there's been some interesting question as well in the chat.
It's only one sentence. I would like to add that the insurance companies, these recommend their clients to the courses, and they say, okay, if you take part in this course, then you get 80% of the fee back, and so they do this job. But it's not enough for us, because the insurance company is one part, but the doctors are the other, and there we have to work more. Okay.
Thanks a lot, Pia. I know it's frustrating with time, but we have, for this one, it's not like the Pluspunkt Gesundheit where we know we have a lot of time and it's a never finished work. For this one, we need to put a box for the webinar and the time. Actually, there were a few points in the chat, and maybe what I can suggest is, in case we don't have the time to answer all of the questions, we'll make sure to make a list, and maybe Andrea and Pia and Heidrun can send some points by email afterwards. We'll make sure that those questions are not lost for sure. There was two sides. I don't know, Manal, if you want to share it now or.
Yeah, sure. So we have another interesting question from Michael. He asked is the OSP also managing the quality management of the program through regular audits, or if it's not the case, we would like, if it's not the OSP who's taking care of that, how is the quality assured? Like, what is the role of health sector and the initiative in sales quality? If you can give more insights.
I will start, Heidrun. Yes, the DOSB also, we have the same criteria for the program, and so if we have a new, and also if another sport organization in Germany have a new standardized health program, they have to evaluate this. We need an income evaluation. That means we send our program to experts, to sports science in the field of health, and they have a list. They know what they have to prove, and they have to say this is okay. This has a good standard, and all the program fulfill all criteria. Then it's accepted, then it can be certified. But we have to have an income evidence. In former time, we had also an outcome evidence to show the effectiveness of the program. But in the last 8 years, it's enough to have an income evidence from experts from the science. And we all in the German sport system, we all work with the same criteria.
Yes, and perhaps as an addition, on the one hand, we have the audits with the university, as Pia mentioned, but there's also an audit from the health assurances, and they have different kind of criteria. So sometimes it's
a little bit crazy.
It's not going in the same way, but yeah.
Thanks a lot to you too. I think let's take the time for a final question. One of them was about how can we use the opportunity of major sport events, even if we are working at grassroots sport level and with public health sectors and all of this call that we have heard from the three of you. Can we use major sport event as a way to work on and to invite people to be more active and etc. That was a question by Maria, mentioning in particular the Euro 2024 next year in Germany.
Yeah, you can motivate or you can attract people if they see other people who are active and they see that it's fun and yeah, this is the function of big events. But they go to such events, they watch what they are doing. Perhaps they think about it, oh, I could do this again also. Perhaps they try and be part of such a game or a physical activity. But very often, this is the one event and then it's finished. And then they do nothing. In our experience, if we have such events, we try to give them a postcard or a flyer, and we ask them where do you live, and try to give them concrete health physical exercise offers of the clubs, so that they can go to them and do it again. But it's not enough to do in one event to be active and I feel, oh, it's okay, it's nice, but you have to follow up with something. And so you need information for them to get them so that they say, okay, this was nice and I want to go to this place and try it again.
Thanks a lot, Pia. That's inspiring. And Maria from our team is also sharing some idea with the movement pills that can be used in various ways. So that could be an inspiration for those of you who are we don't know about it yet. So please check the chat and we will make sure to share it. And Pia, one of your ending word was make sure to follow on. And actually I will just wrap up somehow, because sadly those 90 minutes are over. So I would like to express gratitude to all of the participants. Thanks so much for showing up, for being active in the chat as well. Thanks to our speaker, Pia, Andrea, Heidrun. That was a privilege to learn from you. Thanks a lot for your time. And to ISCA team as well. Some of them were behind the scene today, but they are the architect of what's happening today. So social change is a team sport and behavior change is a team sport as well. So we all need to keep on working together. And before you leave, maybe just to let you know, ISCA will keep following up and nurturing the relationship as it was encouraged by Pia, by Andrea, and make sure that we can create bridges. One of the concrete next steps is that early February we will launch the ISCA HEPA e-learning course. So some of the content that you have heard today will be embedded into this e-course, and there will be much more. So we will make sure that you receive the information, and we wanted you to know that it's coming very soon. For those of you who are not following in ISCA and found this interesting and would like to be updated about what's happening, feel free to follow us on our various social media. That's a add-on to our com team, who is making sure that the work that is done is reaching out to as many of you as possible. That's it from here. A warm thank you to all of you. And we will make sure to send you a follow-up email with the slides, the article, and it's Friday, so I should probably say it's Friday, and enjoy your weekend. It was a privilege to have you.